UCLH is declaring a climate and health emergency for the protection of its patients now and for the future. 19 of the last 20 years have been the hottest on record. Rising air temperatures and extreme adverse weather events are putting our most vulnerable patients at risk now. We're pushing for sustainable, positive change before it's too late.
Our electricity is now sourced completely from renewables, and we will continue to install solar panels on more of our hospital buildings. Installing solar panels on just one site could generate enough electricity to power the equivalent of 70 homes. We have invested over £2 million in low-energy LED lights this year across our hospitals. These use just a quarter of the energy of our previous lights and last much longer. We're supporting our staff to travel to hospitals actively so that individual carbon footprints are minimised. And our suppliers are beginning the transition to electric vehicles. By providing over 500,000 virtual appointments for our patients, we'll help to reduce patient travel by 50%. That's over 14 million miles of travel saved.
Being able to cut down the number of face-to-face appointments has, in my experience, been really valuable for patients. How have things been going with the new inhaler that you've had? Patients really appreciate being able to take far less time out of their day, so it's a really valuable tool to be able to offer to patients so that they can choose what's right for them.
Anaesthetic gases contribute to about 2.5% of the NHS total carbon footprint. And there are two of them in common use, sevoflurane and desflurane. This one, desflurane, is particularly damaging to the environment. So what we've done is take the desflurane away so that people are prompted to use sevoflurane, which is a less damaging gas. Another thing we've done is made it possible to avoid anaesthetic gases altogether by buying 138 new pumps so that we can deliver intravenous anaesthesias. So what we've done is make it easy for people to do the right thing. It's good for patients, it's good for staff, and it's good for the planet.
We will cut single-use plastics and introduce reusable PPE, including masks and gowns. We're committed to buying green and are making sustainability a formal part of our procurement decision-making. We've halved our paper use in recent years, and we are moving to 100% of the paper we use being made from recycled material. UCLH is setting a bold ambition to be net zero carbon in 10 years.